Hello, Mrs. Smith. My name is Dr. Reed. I am one of the cardiology doctors.
Hello, doctor.
I have been reading a letter from your GP. He tells me that you were complaining of being aware of your heartbeat. Can you tell me more about what you have been experiencing?
Yes, doctor. For the past 5 weeks I have been aware of my heartbeat. It sometimes goes very fast. It can be uncomfortable and very worrying.
I see. I am sorry you have been experiencing these symptoms. These noticeable heartbeats are called palpitations. Mrs. Smith, if you don't mind, I would like to ask you more questions about your symptoms.
That is okay, doctor.
So, you said that you first noticed these symptoms 5 weeks ago. How often do you get palpitations?
That's right, doctor. I started having palpitations 5 weeks ago. At first the episodes lasted half an hour and they were coming on several times a day. In the last 3 weeks, I have been experiencing ongoing palpitations. I can feel them constantly.
Okay, so they increased in frequency. Mrs. Smith, have you noticed if your heart beats regularly or not with the palpitations?
I have noticed that my palpitations are irregular. Sometimes my heart beats very fast.
And can you think of anything that could have triggered your palpitations? For example, are your symptoms worse during exercise or during a stressful situation?
I don't do much exercise at the moment. I had to stop going to my exercise classes as I have been increasingly tired in the past few weeks. I am trying to think, doctor, but I cannot relate these symptoms to anything. My only worry at the moment is these palpitations.
That's fine, Mrs. Smith. You mentioned you feel more tired recently. Have you experienced other symptoms, like chest pain or shortness of breath with these palpitations?
Well, I feel slight chest discomfort with the palpitations, but nothing else, doctor.
Okay, palpitations are sometimes associated with increased caffeine and alcohol intake. Do you drink a lot of coffee or tea, Mrs. Smith? What about alcohol?
Not really, doctor. I usually have a cup of tea in the morning. I drink limited amounts of alcohol, only on special occasions.
Okay, your GP mentioned that you have high blood pressure and you were diagnosed with type 2 diabetes 2 years ago.
That's right. I do not have any other medical problems. I take lisinopril and simvastatin tablets. I was also put on bisoprolol and aspirin when I last saw my doctor.
I see. Is there a history of any heart conditions in your family?
My father died of a heart attack at the age of 75. My mother takes tablets for high blood pressure.
Thank you for the information, Mrs. Smith.
That's fine, doctor. Thank you.